Welcome to the New to Medicare Self-Service Tools webinar. I'm Tom Ryan with Provider Outreach and Education. I'll be your presenter. Today, I'm joined by Jennifer from my team. She's one of our clinical staff, and her goal is to help you ask questions and to make sure those questions get answered. Now, also, she's going to act a little bit of technical support if she can in the chat. Again, though, that's probably not her primary function. Well, I know that's not her primary function. So please make sure that if you do have technical problems, I'll give you a place to email in just a few moments. One thing, this program does apply to Medicare Part A and B or traditional Medicare. This is new to Medicare self-service tools. However, Medicare Part C or Medicare Advantage plans are a different part of Medicare. I can provide some limited information on Part C plans, but because it's a different part of Medicare and we don't actually process those claims or are not involved with that, I want to make you well aware of that. The reason that I'm putting that in right out front is that we had 3 or 4 questions asked specifically targeting Part C information, and it's not something I can address today. So I will not actually work those questions into the presentation material. Couple of housekeeping things. First, if you would like the presentation, please download it from our Training Center live events page. Jennifer's going to throw a chat link in there. That will then help you just get to the live events page, get that material downloaded. The material for today is the presentation that I'm going to go through. I will not sit in the presentation the entire time. Part of using self-service tools is showing you the tools, showing you how to locate them and where they're located at in the websites. So I will make sure we do that. With that, I am going to record this presentation. It is to make an encore out of it. What we will do is then post the encore onto our website and onto our YouTube channel. The website is just simply a player that is linking to YouTube. That's the ultimate location. The player will be available for 60 to 90 days and also have the PowerPoint attached to it. Keep in mind, the YouTube Encore will be available for as long as the information remains relevant or until we choose to redo it. This is a new to Medicare type item, so I would expect that to be within the next year or so. At any point in time during this event, if you have questions, please add them to the chat. I want to get you what you need. A couple of things to keep in mind. The more specific you can give me for a resource you're looking for, the better I can help you. If I don't know a resource for that, or I'm unsure of exactly what you're looking for, I may have to take it offline and we'll get back to you via email and kind of communicate in that manner. Last, CMS does want to hear your feedback. What they want to know is, hey, what did we do well? What needs to be changed? Hey, was the PowerPoint useful? Were the websites that I showed you useful? Because remember, this is new to Medicare, so it's kind of a broader picture. They really want all those different opinions. So at the end, I will give you a survey, and I'm hoping you'll take that for me. Couple things to keep in mind, and we put this into all of our presentations. One, the materials do change just like with Medicare. Medicare is not a static program. Therefore, the materials and the information that I show you today may change in the future. Please pay attention to the CMS website. I will talk more about that because that is one of the primary sources of information you'll need for Medicare. Also, I did get pre-submitted questions. You probably saw that you had the opportunity to ask those questions. I've worked as many of those into the presentation as I can, and I'll answer the questions. But remember, I can only answer the question you asked. So if you suddenly say, well, you didn't quite get this one right, or you're missing a little bit of a detail here, great, let me know that. Put that back into the chat. We'll get those answered for you more fully. So what are we looking at today? Today, we're going to look at the agenda and the objective. And first and foremost, it is to introduce you to the resources that people who are new to Medicare really need. By using the term new to Medicare, I'm referring to someone who is within 6 months to a year of starting to work with Medicare or switching the type of Medicare they work with. Now, someone asked me what that means. And by switching Medicare, we may say, hey, have you worked for a facility? That's what you've always done. Now, after 15 years, you're going to start working in a doctor's office. While the resources of the websites are the same, some of the areas you go to may be different. That's what we're talking about. It's also great for anyone just looking for a review. So thanks for joining me, and I'm glad that you're here. Today's agenda, we do want to look at the CMS and WPS websites. Those are the 2 primary websites for our jurisdictions. Jurisdiction 5, Iowa, Kansas, Missouri, Nebraska, and all other national. And Jurisdiction 8, Indiana and Michigan. So Jurisdiction 5 or J5 and J8 will use the WPS website. the CMS website is good for anyone across the nation. The other websites are definitely going to be applicable across the nation. Those websites were added based on questions you asked, things that I was trying to get you to a resource for. So that's going to be an interesting resource section, and we'll go through it as we need to. Okay, couple of things I want to go over. First, we are going to start on the CMS website. I will let you know that from this point going forward, I'm going to use the website. You will follow along with me on slides. The slides give you the basic information, but I want to show you live how to navigate these items. At the end, we will come back to these slides and we'll go through some additional information. So I want to verify with Jennifer that we have cms.gov, the CMS provider website showing. Jennifer, is that something that is showing right now?
Yes, it is.
All right, thank you. For those of you that don't understand that, sometimes technical issues happen and nobody wants to start off with a bad technical issue. So this website, and as this should be maybe slide 5 or 6 in your presentation, something like that, is where most of the information is going to come from when you're looking at the rules and regulations of Medicare. Now you will hear, hey, a rule is the Social Security Act or a regulation is a Social Security Act. The CMS website is the official website of the operations or the daily things we need to know. Okay, that's why the CMS website becomes key and important. So what are we going to look at when we look at this website? And if you'll notice, this is going to be slide 7, key information. First, we need to look at day-to-day operating instructions. I need to help you understand where you have to go to find out how you should do your portion of Medicare, but also what do we have to do as your Medicare administrative contractor or claims processor. All of that's defined on the CMS website. We do want to look in a couple of different places for rules and guidance. And this is your Medicare coverage database, but also the Medicare section. And I will cover both of those. I was specifically asked about CMS's education tools, and that's the Medicare Learning Network. So I do want to cover that, hopefully to get all of your questions answered. The last thing that I was asked for is some contact information for CMS and to explain when to contact each one. So we'll look at the CMS contact information as well. So with that said, that should end slide 7, and we're going to move on to slide 8. Hopefully I'm getting you guys the right slide numbers. I apologize if my slide numbering is a little off here. I'm trying to do it off of memory. The first thing we do want to move on to is the internet-only manuals. Now, the thing that is key with the internet-only manuals, this is your daily operating instructions. It's how CMS tells the contractor and the provider what needs to be done within Medicare. Because it's within Medicare, we will have to go to the Medicare area. Now, it is linked to other places, but we're going to focus on the Medicare sections. So I'm going to navigate there now. Now, if you say, hey, I don't have a navigation trail, it should be on your slide, but also I did give you a direct link on the slide. We don't need to kind of guess our way through this. I just think showing you how to navigate to it is important, at least for one time. Start with Medicare. When you come up with Medicare, a lot of people think, hey, wait, it's going to be under coverage because that's what they feel like the internet-only manuals are going to do. It is not. It's under regulations and guidance. Remember, I talked about daily operating instructions. That's your guidance and regulations. By doing that, we then can move to the right side of the screen, and the very first link in the left column says manuals, and that's where we want to go. When we go to manuals, you will see the screen entirely change, and if you follow the left side, you have a menu, and there are 3 items. There's the internet-only manuals, paper-based manuals, and future updates to the IOM. Please do not recognize or use the paper-based manuals. They are old manuals. They were once in effect, but are not in effect today. The internet-only manuals are what you're going to look at. If there's changes coming out, you may see something in future items, but for the most part, you're going to look at internet-only manuals. Before I leave this area, though, I do want to point out over here on the body, because you'll see manuals that'll explain it, but also then it says related links. The first one is the rulemaking link. If you want to learn how CMS creates rules and why they're created, that's what you want to look at. The second one is called transmittals. This area right here, and I'm going to show you in just a little bit, so don't get hung up on it. I just want to mention it before we go into the actual manual. This is how CMS tells us that there's changes to the manual that haven't been written into the manual yet. They're coming. but they may be binding today. So that's where the transmittals come in and why it's important. And we'll talk again about those as we keep going through this manual section. In the meantime, though, we do want to move back up to the top and we want to go to the internet-only manuals on the left side. Once that opens, you can read a little bit about the different manuals, but I do want to scroll down and show you the chart. There are 25 different entries. Right now I just have it set for 10 per page, but you can open up as much as you want. Each one of the manuals does have a publication number, and you can go through the different manual publication numbers that you want. If you don't want to try to do that, you can search up here. This is a filter. So it's not a true search feature. It's just going to filter this chart. But if you don't know what something's called or where it's at, please don't use the filter. It's not going to help you if you say, I want to know about hospital. Because what are we going to get out of that? Well, it's not in the titles. So we don't want to do that. Now, if you did say, I want to know about claims, it would be able to say, hey, here's what we have to go with claims, the claims processing manual. So you can see it's just searching that title field. Let's take a look at a couple of these to kind of help explain a little bit further. I do want to take a look at the 100-02, which is a publication number, and it's the Medicare Benefit Policy Manual. Now, the reason that I choose this one, a lot of people ask about things that are covered or not covered, or items like that. So what I like to do in particular is to kind of just show people, this manual is broken out by various portions of Medicare benefits. Whether it's a Part A or B benefit, it doesn't matter. And it kind of walks you through all the information. Now, each one is broken down further. Let's go ahead and move down to one of the lower ones. And the reason I'm going to choose this one, I'll explain in just a moment. We're going to go to covered medical and other health services. If you cannot find your coverage up above, and this is the question that came in, they were looking for private practice physical therapy coverage rules for Medicare. Well, if you look up here, we do have the comprehensive outpatient rehab, but there's nothing to talk about private practice physical therapy. In that case, if you're looking for something that's not covered in one of the other ones, default to Chapter 15. This is a large chapter. Now, within this chapter, there are also sections, because that's not confusing, but then within the sections, there are subsections, and sometimes there are subsections. So you really kind of have to look at what you're looking for there. You can scroll through and read all of the different things that you want. If you don't want to do that and you're looking more on a generic basis, please use your edit find or your control F, which is a find feature. And you can do this quite quickly and just say, I want therapy benefits. It will then sort out and say, okay, here's all the hits we have. Is this the therapy that we're looking for? Not today. Oh, here it is. We were looking for coverage of outpatient rehabilitation therapy, PT, OT, and SLP. This is what you asked me about. If I go down a little bit further, you can see it's in section 220 and 230. Now, what's great about this manual is it's linked. So if I click on the title of this section, it'll just move me there and I can read through all of it. So I'm not going to do that for you, but I did want to show you where you would locate that as an example. Again, if you do have questions more on that, or I didn't answer your question for the PTOT stuff that you asked a question on, please put that back in chat. One other one that I do want to mention is this Chapter 16. A lot of people forget to look at Chapter 16, but they are asking us what is excluded from Medicare. When does Medicare not cover a service or item? And Chapter 16 is the one that gives us all of our general exclusions. So we do have to make sure we follow all of these exclusions. Now, these exclusions are based in the Social Security Act, which is why they meet and go into this chapter. So I want to make that clear. They do go into various sections of the Social Security Act, but it is where it all comes from. And you can, again, scroll through. There's a lot of different information there. If you have something in particular that you were looking for, because the question was very generic for the exclusions, not super helpful for me to help you out with. So I just thought I would bring those up. Another person asked, and I want to use another example on it. So I went back 2 screens and I'm going to go to the Medicare Claims Processing Manual. This is different. The Benefit Policy Manual explains what the benefits are. The Claims Processing Manual tells you the CMS requirements for the claims processing system. So there's a lot of different general billing requirements, things like that. What happened is We don't ever want you to ignore the general billing requirements. This is applicable for everyone unless there's something specifically written into one of the other manuals, or I'm sorry, one of the other chapters or manuals to override it. So again, this is general in nature, but something else could always be overriding that if it's very specifically written in that manner. The questions that we got, or that I got particularly, were about filling out the CMS forms for the claims. So I'm going to guess you're talking about the UB04 or CMS 1450, which is the facility claims, or you're talking about the 1500, which is the suppliers, physicians, professionals claims. These are your data sets for those, and it will walk you through all of the information on that. Some people don't realize that these are here, and these are data instruction sets. If this isn't there, this doesn't happen. Sometimes it's even going to tell you this is a conditional field. So if you have a primary payer, we need these filled out. But if we don't have a primary payer, don't do anything with those fields. Those are the types of things you're going to find within this one. So it's really important that you understand that. Another one that I was asked on in particular is this 29, and it talks about the appeals of claims decision. You were looking just for the general regulations that go with it. From what I could gather in your questions, there was nothing specific about any given item. I will correlate this one back though to another area on the website in just a few moments. So appeals is important to understand. The question, other portion of, or second part of that question said, how do I know if something is not medically necessary, which can lead to an appeal if it's denied? So kind of a complex, interesting item there. I'm going to leave the internet-only manuals, and we're actually going to move on to our next slide, and this is the Medicare coverage database. What this coverage database does for you is to define what information has a policy governing it. Policies then have coverage criteria. They go through things like items that will make it covered or not covered, just depending on the situation. They go through items that will say, hey, this may be a diagnosis in an article related to that policy. So there's various pieces of it. So let's talk about the Medicare coverage database next. So we go to Medicare. Now on this one, we're going to go to the second item, and this is coverage. And then the left column, second item, is the Medicare coverage database. Please note it is going to take us to a separate website. That's what this little indicator is saying. Nothing wrong with doing that. It's just taking us out so that we'd be in a different area. Inside the Medicare coverage database, you can read all about the coverage, things like that. We're going to do the search though, because the search is what's really going to show us everything. Somebody asked if they can download off of this. You absolutely can download off of it. It's right here on the top. You can download any of the results. The problem is if things change within the coverage database, are you really going to be able to download and keep up with that? Because you are responsible for knowing all the changes. I'm just going to search the term in general allergy so that we get a bunch of different results. It's a generic term. It may not apply to you, but again, you can search procedure code, could search, a term like allergy. You could search something like foot care or, nail care, anything like that. The hardest part with using this Medicare coverage database is knowing what everything is called. Not going to lie, it gets to be pretty complicated. So things to keep in mind within the Medicare coverage database, it does contain national policies, national coverage determinations as written by CMS, and local coverage determinations as written by every contractor. You'll know what it is in terms of a policy-wise by looking at the type code. So we get an ID, that's just a CMS assigned ID. Then you're going to have a title, the type code, and the contractor. So if you're looking through these, you'll see that we actually, on the very first set of results, have 4 different contractors. Is that going to be really useful for you? It may or may not. It depends on which ones you work with. But if you do want to say, I don't want to do all of that, you can change it and say, I only want to know something in my state. The first one I'm going to come to is, let's use Indiana, that's J8, or you could use Iowa, that would be J5. So apply your state, and then it will automatically remove contractors not applicable to that state. Really nice tool there. Then what it will do is say, okay, we have an LCD. Again, the WPS wrote this. That's what's telling you here. We are a MAC, or a claims processor, for Part A and Part B. You also have an NCD. Now, this one doesn't have a contractor because CMS wrote the National Coverage Determination, or NCD. Also, we keep going down and we have what are called LCAs, local coverage articles. They just call them articles here for short. Again, it's the coding and billing information from the system as related to a LCD. So if we look at this one, 57472, and we slide back up to the top, you'll have something relatively related to that. So this is allergy immunotherapy, A57542. Here's the LCD with an L code, and here's the same title. Notice the billing and coding is just in front of it. That's how it works. Now, can you have, the question that was asked of me regarding an article is, can you have an article without an LCD? And the answer is yes. We can also write an article that relates to an NCD, that relates to those national coverage determinations. So you could have that. We also may have an article related to certain edits and system information you need, which does not relate to an LCD or NCD, but it's still something that will help you through our system edits. If we continue to scroll down, all of the entire documents are published in here, and a lot of people ask what that means. National coverage analysis used to create an NCD, old local coverage determinations or existing coverage determinations. Let's keep going. Proposed local coverage determinations. So we're talking about changing something. Here's what you have to know. And then again, just kind of scrolling through, you can see LCDs, NCDs, all of those different types of things. One thing I want to remind you is that there will also be response documents. Okay? Response documents actually do come from the contractors. Okay? You can see here's response to comments. So we posted this, it was a draft. Once we did that, we got a bunch of comments in, we then responded to those. That's what this is. So this is one of the best resources. I was asked in particular to look at or to explain a little bit about an LCD and some of the layout. I will do that. And then we'll go on. So we're just going to use the allergy testing one. I could use the allergy immunotherapy. All LCDs are basically laid out the same. On the CMS website, because these do use CPT codes or have the potential to use a CPT code, we want to make sure that we accept this description. Okay, here's the highlight of allergy, which is what we searched for. And then we just kind of look through contractor information. We already determined that it's going to apply to WPS, but just in case you hadn't determined that, you can look that up. All the basic documentation information. Here's the national coverage policies that we are citing or using to write this. So you can see they're in the Social Security Act, they're in the Code of Federal Regulations. Other areas where you might want to look at those manuals that we talked about, they're right here. And it will tell you which one you want to go to. Then you hit coverage guidance. This is the important section because it explains in verbiage why we'll cover something, why we won't cover something, the things you need to do. This is what Jennifer, as our clinical staff, teaches right here. She starts with this and then she's got to go through all these different sections. As we go down a little bit further, you can see, it's coming up based on that, and I'm just scrolling down to the bottom. So look away if you don't like a fast scroll. I apologize for that. Summary of evidence, which is down here on the bottom, and this just provides why we did what we did and what happened. Now, summary of evidence for some of our older policies like allergy testing hasn't been added because it wasn't required at the time. Analysis of evidence, rationale for determination. Again, these two are newer sections. Documentation requirements. Again, going to walk you through what we got to have in the documentation. Utilization guidelines, all of the sources that go with that. And then we get the revision history. If we keep going down below revision history, you come up to the attachments, which this one doesn't have any, and then you come up to the articles or the information that's related to it. Here's the two articles. This is your coding and billing or your system guidance. This is the response. Here was the original draft, and here are some NCDs you may need. So that's how you would read that. Hopefully I got enough in-depth enough that I didn't miss anything, but I didn't go too in-depth for you. Let's go back to the CMS website, cms.gov. I'm just going to take all of this out. The next item, which will be your next slide, is what's called Medicare. And that's just this area right here. It's literally the term Medicare on the front of this. It's the left side, little ways down. And you've already seen me use this a couple of different times to move to different items, but there's a lot of information within the Medicare area that you want to be aware of. When people ask for what is the CMS guidance, so we went through the regulations, we went through the medical necessity section, but does CMS also offer guidance? And that's what this Medicare area is all about. So there's a huge amount of information. As I said, what we'll do is we'll look at the appeals and grievances. We did talk about that with the IOM. Those are the instructions, remember, in that manual. But CMS does then go on to offer you a little bit more on appeals. They break it out by the appeal type. So they cover original Medicare, Medicare managed care, prescription drug, which are all still portions of Medicare. We are going to look at the original Medicare, the Part A and B Medicare stuff. Again, not sure exactly what you guys were looking for here, but this just goes through the 5 levels. Some additional information you may need is all on this left side. If you want to read through general information, always look to the body. And it's going to give you a lot of different general information. Again, one thing that was asked for me is but can the provider file on behalf of the patient, and where's the guidance on that? It is right here. A lot of people don't know this. Yes, a provider can file on behalf of the patient. However, there are limited circumstances and you need to make sure you do it correctly, because if you do not have this form right here, it's considered a provider appeal. So hopefully that helps you locate that. This was asked by an ambulance provider who's asked to file for medical necessity based on an ambulance run. So hopefully that kind of helps get you where you need to go to get that information. Please make sure that you are completing this form and that you are doing all of the elements within this, okay? Otherwise, you're not going to follow through on the guidelines. All right. So again, that's the appeals information. It's just an example of what you'll find in the Medicare section. But as you can see, there's a lot of other information within here. Another one that we were asked about, if you scroll all the way down, the very, very last one is the coordination of benefits and recovery. Then they were asking about Medicare secondary payer, or MSP, and this is under just the general overview. And as you look, it's the coordination of benefits and recovery overview. Medicare secondary payer is the second item. Though most information within this will also apply, I'm not sure exactly what you were looking for on this web page, other than to say, hey, you're looking for Medicare secondary payer. Show you one more thing before I leave. In this Medicare secondary payer area, a lot of people don't realize that if you scroll all the way to the bottom, you're going to get through some common scenarios, things like that. But as we get to the bottom of this, you can look at different related links that go with it. So it's important to make sure you're well aware of that. And then if we scroll down, there's an actual MSP training information from CMS that'll walk you through different components of MSP. We do offer live training on this as well throughout the year, so keep that in mind. This will give you the written format if you want that, but the live portion does come from WPS. That does then bring us to education and training. So someone was asking in particular about education and training, and that's over here. That's in the training and education section, not Medicare, training and education. Medicare Learning Network is the primary source that I'm going to focus on. And inside there, we're going to go to resources and training. Again, you can see there's a couple other things inside there. But inside here, we can look at and see what CMS offers. The most common one that people are looking for is this publication and multimedia. Web-based trainings are great. They do offer you certificates at the end, and you can translate those into CEUs by contact hours. But the publication and multimedia, there we go. It does have a filter on it, so you can search whatever you want. One of the areas that we were specifically asked about is some preventive service stuff. This is a great little training chart for it. Again, it was the first item. It's called Medicare Preventive Services. You can pick your preventive service and it'll walk you through all kinds of information on it. So let's just do diabetic screening just for a moment. And you can see, okay, here's your codes, your ICD code, all kinds of fun stuff that you need in there, plus some FAQs and additional information. That's just an example of something that you could potentially get off of the Medicare Learning Network. If you say, hey, I don't really know exactly what I'm looking for, but I want to know if we have something on teaching physicians, it's a common one that we get. The information is actually going to be in guidelines for teaching physicians. You can see I used a filter up here. I typed the word teaching and it brings me to the article or to the booklet. Download it and it'll open the booklet for you. So not really sure where we're looking for anything more than that. Again, we'll stop there with this one. Um, One of the areas that we did not go over that we do want to just jump back to for a second is, again, we're going to go to Medicare, regulations and guidance, and then the word transmittals. So when I was talking about the manuals, remember I said, hey, there's information you need to know about updates that have come through that haven't been written in the manual yet. Those are called transmittals. That's this section. Current transmittals are done in a different form than older ones. So these are the really old archives. But the current transmittals are all contained on a chart. Now, current 24, 23, they're broken out by year. You can see all the different years. But here is where you're going to find just a variety of pieces of information. So if you're looking for something in particular, jump through it. One of the questions that was asked of me is there an easy way to filter? And the answer is no. Just because something is on this chart doesn't mean you necessarily know what it's called. So is it called claims processing? Is it called ambulance? Is it called opioid treatment? So you have to sometimes filter for a variety of different things on the chart. So if we just want to know if ambulance is there, as an example, we go ahead and type the word ambulance, click apply. Not today. Okay, well, what about transports? And again, not today. But if we wanted to do something like dialysis, you can see, okay, we do have an independent dialysis, and it's renal disease, all of those. This is what we're looking for, maybe, maybe not. But it also then tells us it's chapter 42 and a variety of pieces of information. If you open this up, it'll bring you to another page where it explains, gives you a little bit better explanation of it. And then the download section contains the actual item. So hopefully that answers your question. I'm not sure what you more wanted with the transmittals or how those updates come in, but I just wanted to make sure you had that. Last item for the CMS website, for this CMS website is up here, and it's about us. And the reason that I opened it right away is to show you the contact us section. This is what people have asked us for multiple times. Contact us. So if I select contact us, it'll open up on the bottom and it's going to say, do you want to contact us? Do you want to contact? What are you looking for here? I'm just going to go to the general contact us information. Hopefully this is what you want. And then it'll explain the different types of information that you may want. So do you want to go to our regional office? Do you want to go to the Baltimore office, which is the main office, central office. The regional offices are located across the country and they run the individual contracts. So for instance, for us, we report to Chicago regional office for Indiana and Michigan, and Kansas City regional office for Iowa, Kansas, Missouri, Nebraska, and the national provider contract. So again, that's how it works. Again, J5 is Iowa, Kansas, Missouri, Nebraska, and the national, and J8 is the Indiana and Michigan. But each contractor then controls certain things. One of the other things that goes with that is just making sure that you're contracting the central office versus the regional office, or I should say central versus regional. The regional really works with the individual contractors and the individual day-to-day operating instructions of the contractors and making sure we're meeting all the requirements. Central office in Baltimore, their job is like the policies that we looked at, the NCDs. Their job is the internet-only manuals. All of those types of things are central office. I will tell you, if you're not sure and you're not really sure where to go, one of the things that is nice is to start with your regional office. If it's not them, they'll just refer you on. Next is an item that we had is the provider question specifically about the patient website. And the reason that it is different, so this will be on your next slide, is because it's a completely different website. So should you refer someone to cms.gov? Well, the answer is, who are you referring to it? If it's another provider, absolutely. If it's a patient, absolutely not. The patient website is medicare.gov. And you can see I just brought it up. It's going to be, again, a different URL, but it is still a federal website. This website does have a variety of things, including a patient portal, so they can look up their claim status. They can look up information on their claims. They can do a variety of different things like that. When we look at the website, one of the things I want you to be aware of is this Medicare and You handbook, and it's going to be under basics and then Medicare and You handbook under resources. This handbook is the official guide sent to every single person with Medicare or every household if they elect just to have a household send. The important thing about the Medicare and You Guidebook is this is what the patient has to know about Medicare each year. It does change. It can be a little bit more or a little bit less, but it's normally between 125 to 150 pages long. The provider is then responsible for knowing everything else and making sure the patient's aware of it. And that's why some of the different things happen and some of the different forms are used. So I just think it's a great opportunity. If you've never looked at Medicare and You, take a look at it. Take a look at how CMS tells the patient certain things. I think it's a really good chance for you there. All right, on the next slide for you guys is actually going to be a question slide. I do have one pre-submitted question. In the meantime, throw those questions in the chat. Pre-submitted question is, how do you bill Medicare? And the answer is, well, you either bill electronically or you bill on paper. I showed you the electronic billing manuals and chapters within that manual to claim. So you want to make sure that you're following that set of information. However, if you're billing electronically, no, those information does not apply. And I'll show you a resource coming up next on WPS that will help you get through that, or when you bill us as your Medicare administrative contractor. Other MACs do have different resources available. Jennifer, did we have any questions?
There's no questions at this time.
Okay, Jennifer did put a link in the chat. It's called the Corporate Electronic Data Interchange, EDI. Now the electronic data interchange is just where you're gonna go. Okay, electronic data interchange, just where you're gonna go. What that is for electronic claims. Remember the 837Is, the 837Ps, that's the corporate website, doesn't come in directly to Medicare. Next slide should bring you to what's called WPS website. Now this one I will talk a little bit about, probably not quite as in depth because you guys didn't have as many questions, but a couple of things to keep in mind. The first thing I'm going to address is I'm a Part A facility, but I'm billing for a Part B service. Which section of the website do I use? Well, you will use the Part A section. That's what it's labeled on the top. Here's how I want you to think about Part A versus Part B on our website. Again, it's wpsgha.com. Part A is for people that bill on a UB04 or 837I. It is not a benefit category. Part B is for people that bill on a CMS 1500 or 837P. Make sure that you're following the correct set of information. The reason that we recommend that is sometimes the systems work differently because there are two systems. One, the Part A, the UB04 837I is called the Physical Intermediary Standard or Shared System. The other system is the multi-carrier system, MCS, and is for 1500 or 837Ps. So that's the number one piece of advice I'm going to have for you there. Please make sure that you follow that. Also, make sure you're in the correct jurisdiction. We do have edits based on fraud and abuse and based on things like that. Those edits may not be the same based on what's happening within those jurisdictions, so you want to make sure you're getting the most current information for your area. Along with that, on the next slide, you'll see where it says public section. That's this area that we're in right now. There is something called a secure section, and that's right here. The reason that I put that in there is because a question came in about calling us and why can't we help you through getting claim status and other things. That's prohibited by CMS. If it's available on our website in either area, public or secure sections, then you have to use that self-service tool. It is a requirement under the customer service program as written in the manuals by CMS. Jennifer should be putting a link to that information for you. A couple of things to keep in mind with the public section. We divide this separately by topics. Okay, so each topic then contains a functional work area, which is why we have them set up that way. Okay. So you want to make sure you're aware of which topic you're looking for. Is it documentation? Is it medical review? Yes, the two tie together, but documentation is a much broader category than medical review. Is it an appeal? So yes, documentation applies to appeals, which is why we have its own category for it. Okay, so just make sure you're going into that. If you can't find something, and this was one of the questions that was asked, what's the number one area to go to if you're trying to locate something, you can't find it? It is claims. It is claims. You could also do a search. It'll search our whole website for you. It will not search the secure section. Our search feature is not for the secure section. That's done separately. So hopefully that kind of helps answer those questions on the public side. We don't really have a ton of questions on the public side, so I'll go through one other question and then we'll move to the secure section. The question is a statement plus a question. You used to have a list of LCDs on your website. It used to be in the policy area. Where is it? That list is actually now in tools. And if you go to the LCD and article lookup, you'll find it. Now you'll see the code lookup, which is what is right here. This is a quick link to it, but the actual tool itself contains the list that you're looking for. This one used to be in policy. It's now under tools and it's contained on that lookup tool. So hopefully that answers your question regarding that. When you want to navigate, please remember that part of navigating is to understand where you're going. Topic centers are going to be your related information to certain items specific to claims, which you'll notice that then doesn't have tools in there because the tools relate to certain things you want to look up, but they're not necessarily related to a claim. They could be, but don't necessarily have to be. The training center is a little bit of a different area. We do train on claims, but because training is such a bigger, broader category, it became its own training center. So training center, contact us. That's exactly what it sounds like. How do you want to contact WPS and how can you get in contact with all these different areas? On the training center, I did mention the Encore page earlier. So here's the live events. You can see it has a list and it does allow you to download any material. But also here's the Encore. It will list the Encore, the dates, and the time. If you open this, so let's just use who to contact. What we have is, again, this big white box is a player. It's actually loading right now. And then you have the follow-up, which is going to be the material, the presentation, and then if you want to leave any feedback on it, you can do all of that from our website. Hopefully that does kind of help you understand that information. Okay, a next question that we did get is, that I'm going to cover is on the secure section, and that's up here. I will tell you, I personally cannot log into the secure section and show it to you because it would give you PHI and PII because both of that is contained, which is why you must have a unique username and password. So yes, each user is required to register and have a unique username and password. Answer number one for the secure section. Answer number two, how do you register? You can click the word register, but if you are looking for the steps, I recommend using the portal user manual. You can see the link right here. It's also going to be linked down on the bottom of every screen. When you come in, scroll through and it'll say registering for initial access. It's going to walk you through all the steps with screenshots of that. So hopefully that kind of gives you a lot of information there. You will also hear this product referred to as SNAP. That was another question. So I want to register for SNAP. Well, this is SNAP. It is the Secure Net Access Portal, otherwise known as the portal, otherwise known as SNAP. It's all the same thing. Please don't get confused over any of that. Okay. What type of claims correction can you do within SNAP? And this was asked by someone that submits a 1500 or an 837P, and that's key. Because if you submit a 837I or UB04, your claims correction occurs in DDE, direct data entry. But inside SNAP, you can actually do what's called a clerical error reopening if you submit a 1500 or 837P into the MCS system. How do I, find information on that? Again, you have to go to the manual. You're going to scroll down and you're going to find, what are you looking for? Customer service, credit balance. Nope, still doesn't seem right to me. Oh, here's transactions. Under claims, we can do the clerical error reopening. Now, if you want more information, there's also an article that you could look at for that. I'm going to have Jennifer put the direct link in there. I'm going to type in the search feature just to show you how that uses. Oop. By doing that, it brings up the different forms that you can use, and then it brings up the two articles that you might need, how to request a clerical error reopening. So again, it's all going to be there for you. It's just how do you want to navigate to that? Okay, I do recommend getting a little bit used to the navigation. Things that aren't going to be up in this search engine, the training center doesn't come up in the search engine. And that's specifically designed because it's set for training and we want you to go to the training center to kind of view what's there. It is a little bit of a known issue that we have and we are working to resolve that, but we do want to make you aware of it. The topic centers all will the tool as well. We were also asked if there's guides and manuals on our website, and yes, there's a variety of them all over the website. Easiest way for me to tell you to find a guide and manual is come to the bottom. Look down here, DDE manual, portal user manual. Those are the two biggest ones that we get asked questions on. So I'm not really sure what other type of manual someone would be looking for, but if you are looking for either one of those, they are here. If you happen to be someone that uses the interactive voice response system or IVR, we do have a manual on that as well. And if we scroll back up to the top, you can see in quick links, there's an IVR conversion tool. It'll walk you through, but here's the IVR operating guide, which is the manual for it. I'm not sure what else you would be looking for with that. So those are the three that I was aware of that we were kind of asked a little bit about. So if you have more, let me know. Which would bring us to slide 20, which is question and answers. So let's go ahead and jump back to this PowerPoint. I'm just going to get down to that slide. Bear with me for a moment here. All right. First question that we had pre-submitted, is there an article or is there help for something that is billing greater than $99,999? This person is a 1,500 biller, and the answer is absolutely there is. We actually do house an article on it. I don't want you to navigate to it if you don't have to. I always recommend go ahead and put what you want in the search feature. There's the article right there. Jennifer's going to give you a direct link in the chat. Once you open it up, it will walk you through. The reason that I did this one in particular is also to show you one other feature on our website. This box right here says just under jurisdictions, J5 and J8B. It's telling you that in the top part up here, you're looking at claims that are submitted on a UB04 or 837I, and this article is only for 1500 or 837P billers. If you simply select the top jurisdiction, it will go away. Okay. It also will tell you right here the jurisdictions. So that's where I was talking about. Make sure you're getting the right information. This does not apply to a UB04. Their claims can be millions of dollars. Doesn't apply to an 837I. Again, millions of dollars. So it's a very different system and setup, and the way we break things out needs to be different. And that's why I wanted to point that out as well. So that's a great question, and thank you for allowing me to do that. One other question that came regarding ours is there a section where we can find information on documentation that's needed? This is a great tool. I do recommend, again, coming to the documentation topic center, going through and reading what we require for different components of documentation. If you don't find something you need here, please let us know. We're always willing to take chat comments. And if you scroll down, you can see need help. It's going to give you feedback. It's going to give you all those. You're going to use feedback or web help, either one, but feedback will be able to help us get through this. You can also use the feedback tab here and tell us what we're missing, what you think you would like us to see. We'll consider all of those different types of items. Another area we want you to be aware of when you're looking for documentation is medical review. Now, medical review is not going to have standard documentation, general information. That's the documentation one. However, if they're doing a targeted probe and educate, it will walk you through documentation that they're looking for that medical review. In general, it's going to apply to everyone. There's no one that it won't apply to. So please make sure that you're well aware of this. I think it's a great opportunity and a great resource. Jennifer, any questions?
No questions at this time.
All right. The next section is other resources and other websites. I'm not going to go through these ones individually. I'm actually going to use the PowerPoint for this. If you do want me to show you something, again, put it back in chat, but otherwise we're just going to talk through these ones. So we were asked about appeals, and again, this seems to be a common theme, is where do you find appeals information? I want to let you know that the Department of Health and Human Services, which is the department that oversees CMS, the Center for Medicare and Medicaid Services, they actually do the level of appeals that goes above CMS, so level 4. So when you're looking at that, you'll go to CMS's website. It'll explain all 5 levels. It'll access you to the DHHS website for a level 4 appeal. That's the Department of Appeal Boards. Now, how that works is your Medicare administrative contractor, us, we do the first level of appeal known as a redetermination. There's a second contractor called Qualified Independent Contractor, completely separate from us, and they do a level 2. CMS does a level 3 with their attorney adjudicator or their administrative law judge. but that's level 3. Level 4 is done under the Department of Health and Human Services, and that's one of the main reasons people want to access this website. So we just thought we would put it out there. You can also file information on complaints to them, and they will investigate those complaints. So again, take time, check it out if you want that information. Hopefully it will help you just by, go ahead, select the link. I'll just do this as an example. By selecting the link directly on the slide, it will open the website directly for you. And then you can move around. And this one in particular, if you're looking for this, go to the top part, read about the different information, whatever you want to look at. So it's different things that are happening under the Department of Health and Human Services, whether it's, regulations, whether it's guidance, what is it? Let's go program and services. And then if we're looking for the stuff that I was just talking about, if we scroll down, what are we looking for? And the answer is complaints and appeals, which of course happens to be in the lower right corner. And if you click on that, then you can find out how to file an appeal and do all those different things. But this is where you'll see some of the different pieces of information for you. Here's the Department of Appeal board that they were looking for. So that's that 4th level. One other area that we are frequently asked about is the Social Security Act and the Office of Inspector General and how they work together. So I thought I would separate these two out a little bit to answer your question. First, the Office of Inspector General does follow the information within the Social Security Act. They report to the centers, or they report to the Department of Health and Human Services. Therefore, they are not just about the Centers for Medicare and Medicaid Services. They do anything under that. Now, under the Department of Health and Human Services. So they're kind of, I guess for lack of a better word, they're a legal watchdog. What's great about the Office of Inspector General is that they will publish what they're looking at. It's called a work plan. So that's one of the questions, and the work plan is available on their website. So you can also report fraud and abuse to them. They will then refer it to the appropriate entity or open an investigation onto a fraud and abuse complaint. Key things there. The last one that's on here is the provider exclusions list, and this is very important. When you are enrolling with Medicare, even if you're updating your owners, all of that, the provider exclusion list can indicate to you that someone should not be listed and it's not eligible to be a part of Medicare. So that's one of the things we just wanted to point out. They could exclude you from even getting a Medicare billing license or a Medicare billing number. All right. The next one, Social Security Act. The Social Security Act for me is quite simply the law that puts Social Security in place, and how the law is done. It can be amended. Different laws do amend different sections, but I wanted to just briefly bring that up because the Code of Federal Regulations, which was what the next question was about, or the previous part of the previous question, is the federal newspaper, for lack of a better term. What this really does for the Code of Federal Regulations is explains the Social Security Act and how we're going to implement the portions of the law that are part of the Social Security Act. So it's the implementation under all the executive departments. It's a newsletter, if you want to call it a newspaper, whatever you want to call it. There are proposals put out within it. You are allowed to comment on it, and then there's final implementation information put out within that. That final implementation is then given to the Center for Medicare and Medicaid Services, and they then have to put together how the implementation is going to happen, when it's going to occur. That's all done in the transmittals to be added to the internet-only manuals. So hopefully that explained that process well enough to answer your question. But again, this is what it is, and that's why I put it in here. Comprehensive error rate testing. Again, I was asked about documentation lists. Yes, the comprehensive error rate testing contractor has a documentation list. This program is done independent of the claims processing. This program creates the national paid claims error rate. So what they're looking at is complex medical review and a random sample. So in order to help you through that complex medical review, they do have a variety of items within the C3 hub and their documentation checklist to make sure you get them what they need. Otherwise, you'll get a documentation error and we won't review it for medical necessity. We'll just take your money back. And we being WPS, they do contact us and we actually do take your money back. The last one that I wanted to talk about was the recovery audit contractor. Now this contractor is not a contractor that is going to do random sampling at all. So yes, they will look for documentation and they do look at what is going on. The question in particular was, why do I have more than one rack? Well, my answer is, where are you and how do you bill? Racks are broken up by areas of the country, just like Medicare administrative contractors are, and then the type of bill, which can affect which region you fall into. So keep all those different kinds of things in mind. The recovery audit program, their job is to target certain types of high dollar or high volume issues. The issues are then proposed to CMS. They are approved or not approved. Once approved, they are put on the CMS website and medical review can begin. They may be a national review or not. So a lot of different things with that one, but hopefully I got you what you needed on that. Again, all these different links will help you to those websites if you need to. Which brings us to our final Q&A. We do have one question, and it's new to billing Medicare, and they want to look up the correct spot for billing question and answers. Okay, first, there's two different things I want you to keep in mind. Start with the CMS website. Start with the internet-only manuals. That's the interpretation of the rules and regulations as I explained. If it's in there, everyone is bound to follow that. Next, move to the Medicare coverage database. If it's in there, that's a pre-submitted information. It will give you, or I'm sorry, that's information about medical necessity, which is part of the Social Security Act, but it is going to help you with understanding billing question and answers because they have articles that talk about what the billing system does. Very important. When we then move to the contractor guidance, though it's available on our website, wpsgha.com, but only for our states. So when you're really looking at it, please keep in mind there are various places to go to get that type of information. And it's really going to depend on what you're looking at. All right. Jennifer, any questions?
There's no questions at this time.
All right, well, I'll keep rolling. Want to make you aware that we will do a follow-up email directly after this event, probably within the next 5 minutes. The follow-up email will offer you the chance to take the survey. I'm going to talk more about the survey in just a few moments, but it will also give you one other thing. It's called a certificate of achievement. That certificate does contain your contact hours. It's one contact hour for today's event. That certificate should be saved. That email should be saved. That's translated to your governing body for your CEUs. How they would like you to do that is up to them, and we can't advise you on that. This is what we offer you. Survey or follow-up questions before we get to survey. For follow-up questions, please keep in mind that you will have 7 days to send me any follow-up questions related to today's topic, which is new to Medicare self-service tools. If you have a new to Medicare in general type question, please feel free to include that as well. NTM stands for new to Medicare. So NTM : self-service tools. We'll get that answered for you in an email. Survey, please take our survey. Again, it's important for CMS to know how well we did, not only with this education, but as a contractor. So incorporate all of that information. There's a variety of questions within it. One of them is just a general question about us as a contractor. The other questions all relate directly to me and this education, and it's important that I look at that so I can improve and get you what you need. So tell me the good, the bad, and the ugly. What did I do well? What could I improve on? Did you like my PowerPoint and the different resources that we have available that I showed you? So the good, the bad, and the ugly. All right, but take that survey within the next few days. It'll help me to gauge what else we need to do. One other thing that is available with this survey, and I just want to remind everyone of this, is that you are going to be given an opportunity to add topics in there. Any topic you want, doesn't matter. So please take the chance to do that. You can use the survey link in the chat. You can use the pop-up box that's going to appear or that message. Also, if you're listening in the encore, you're going to have a box like the top one which says online survey. Feel free to take that too. We want your feedback as often as we can get it. All right, that's it. That's all I got for you. So thanks for listening. We really do hope that you found something useful within this webinar. Again, remember this survey and give us as much feedback as you can. On behalf of myself, Jennifer, all of Provider Ocean Education, thanks for participating. We look forward to your survey comments and hope to see you in the future. You may now disconnect.